If you're ready to travel without fear of falling, if you're ready to run without leaking, if you're ready to play without pain, then you're ready to love your life. Welcome to Love Your Life TV, where we discuss how physical therapy can help you live your best life.
Hello again, it's Dr. Lauren Peterson, Clinical Director and Doctor of Physical Therapy here at Physical Therapy Balance Centers of Oklahoma City. Today, I'm here to tackle the super fun topic of what exactly you should expect on your first visit with a pelvic floor physical therapist. In short, there will be a lot of questions, a hip and pelvic external exam, and if you are comfortable, and sometimes depending on the complexity and time, if we have it, an internal pelvic floor exam. This will only be occurring once you're comfortable with the idea, and we will explain in detail why it is medically necessary. So now a little more detail. We will take you back to a private room and you'll meet with a doctor of physical therapy. First off, those super fun questions. Expect things you wouldn't discuss with most people. Questions about urine leaking, bowel leaking, gas, bowel movement, and yes, most likely your sexual functioning. We'll give you quite a few yes/no questionnaires to answer on paper, and then we're going to go over that with you and then ask even more details. Most people are going to feel a little awkward discussing these topics with someone they've never met, but rest assured, it's totally normal to us. We need to know the awkward details so that we can figure out all your symptoms and how the state of your pelvic floor is affecting them. So now your external exam. We are trying to get a true picture of your core muscles. That includes your stomach, which is your transverse abdominis muscles, your low back, your hip muscles, and yes, those pelvic floor muscles. We need to know that your hip and your pelvic floor has the proper range of motion and strength. So those external muscles, we do a 5-point manual muscle test. And there's actually 6 planes that your hips can move. So it's a little involved, but we really need to know how strong all those motions are so that you can have optimal stability to support your pelvic floor muscles and your functioning. For your pelvis to function, it needs to be loaded properly. So that not only involves that proper strength, but also the proper alignment. So to determine that alignment, we're going to be kind of poking on those bony landmarks of your hips and looking at how equal your legs seem to be or really are. We'll kind of explain more about that in the session. So now that internal exam, again, it's only going to be performed when you're comfortable and when you understand why it's necessary. We will need to examine the tone of those pelvic muscles, as the muscles really need to be pliable and not tender to palpation for most of life's vital activities. So that's concerning bowel, bladder, and sexual functioning. Then we will do a manual muscle test of your pelvic floor. It's a little different than the 5-point scale. We need to see if you can Kegel or do a pelvic floor muscle contraction. They're the same thing. And if you cannot do a pelvic floor muscle contraction, we need to know how long you can contract those muscles, and if you can voluntarily release it, how quickly you can voluntarily release it. And we need to know if your pelvic floor is going to co-contract with other muscles. It really should only be co-contracting with your abdominal muscles. There shouldn't be any butt gripping or inner thigh squeezing. And we need to know if it co-contracts with a cough. People with pain should generally need to be taught how to relax their pelvic floor muscles before they tighten them. So if you are experiencing pain, no Kegels for you right now until you see your pelvic floor PT. Most people need better control of their pelvic floor muscles, as it allows you to not leak any urine, not have painful bowel movements, not have painful intercourse, experience less urgency, no more needing to look for a bathroom every 10 minutes. If you need to know where there's a bathroom on every route that you take, come see us. You shouldn't have any sort of pain with any vaginal penetration. Tampons shouldn't be an issue for you, and you don't want intercourse to be a barrier for you and your partner. So all these things allow you and your therapist to set goals for your physical therapy and to get you back to loving your life. As you can see, a pelvic floor evaluation is fairly involved, and it's usually mostly about education about that pelvic floor and why your condition is occurring. There might be a couple stretches and breathing exercises on your first session. However, the real work is going to begin on that second session, when we will review what we gave you, answer any questions that might come up, because usually there are a couple, and start you more on exercises, functional activities, and likely some manual therapy to get you started on your journey to healing and back to optimal functioning, whatever that looks like for you. If you have any bowel, bladder, or sexual concerns, we'd love to answer any questions that you might have and how pelvic floor physical therapy could help it. Hopefully this video cleared up some misconceptions or just questions on what you should expect from a pelvic floor physical therapist down here at Physical Therapy and Balance Centers of Oklahoma City.